group are cetaceans, which is our porpoises, dolphins, whales, pinnipeds, which are our seals, sea lion, walruses, our sirenians, which are dugongs, manatees, sea otters, which belong to the otter family, and then, of course, polar bears. I'm going to talk primarily about this group of animals. Polar bears, although they are considered marine mammals and in the environment that they live in, I would like not to discuss those. What we'll primarily discuss are diseases that we're seeing within these four groups of animals. Our cetaceans, of course, are our whales. We have our toothed whales, which are odontoceti, represented here by a porpoise, our mysticeti, which are our baleen whales. The whales that we know the most about are our odontocetes, because those are the whales that we can essentially keep in a captive environment because of their diet. Mysticeti, I don't think there's any way for us to get tons and tons of creel that these individuals eat to be able to maintain in a research or a show environment that we see large numbers of these animals in. Our pinnipeds are divided into different groups. Our phocids, which are true seals. These animals cannot really ambulate on the ground. They kind of squirm, but believe me, they can move fast if you trap one. They can bite hard and move faster than you really think. Of course, our otards, which are our first seals, sea lions, things like this. They ambulate around quite well on the front flippers. Then our walruses are also in this group too. Our sirenians, which are our sea cow, there are really three groups. There are dugongs, manatees, and of course the stellar sea cow, which is extinct. The two groups, the manatee, of course, is endangered. It's found primarily in the Caribbean area. The dugongs are found more across the Indian Ocean area. The difference between the two animals is the dugong has more of a flipper-like back, fluke-like tail, make it more seaworthy than manatee, which is more inland. And of course, the last little animal over the past few years has gotten a lot of attention is the sea otter. This animal has gained its reputation as being serious because of its fur coat. It was hunted almost to extinction in North America by the fur traders 100 and some years ago. It's made essentially a comeback. It's not endangered in Alaska, where it came into prevalence during the Exxon Valdez oil spill. This animal is a relative newcomer to the marine environment. It doesn't rely on fat to keep it warm. It relies on its coat. If that coat is degraded in any type of way, it goes into hypothermia and die. Maintaining that coat is a time-consuming effort on that animal. It spends the majority of its day preening itself, blowing air in that coat to keep itself warm. That is one of the problems with this animal, why it took so long in rehabilitation of these animals during the Exxon Valdez oil spill. They would have to be monitored, washed, cleaned. Once they're cleaned of oil, it would take several weeks for an otter to get his entire coat, completely rehabilitated to the point where you could release him into an aquatic environment and give him some sort of a chance to survive. First group of diseases, I'd like to talk about viral disease. The way I'll present this lecture today is I'll discuss viral diseases, bacterial diseases, fungal diseases, parasitic diseases, and then miscellaneous diseases, or neoplasms and then miscellaneous. First group of diseases I'd like to talk about the pox viruses. The first one to discuss would be dolphin pox. This pox virus is somewhat of a unique pox virus in that it's really not a proliferative disease like we expect to see in most of our pox viruses. What you see on these animals is somewhat of a discoloration here, as you can see right here, and it almost has a geographic pattern to it, leading to the name what's commonly called is tattoo. As you see here, notice a tattoo or geographic pattern that this has. This is not a proliferative lesion. It is very smooth. So consequently, why they get this pigmentation, we do not know associated with it. It usually can occur anywhere on the body, but usually around the head and on the flippers or on the fluke is where you see these things most commonly in these animals. Histologically, we see some ballooning degeneration of the epithelial cells with prominent intercytoplasmic inclusions. This disease tends to proliferate over a period of time. If you scratch these lesions, abrade them some so that they bleed, they may regress, then at that time causing some necrosis and ulceration within these areas. It's not a life-threatening disease to these animals. However, if you abrade these things and they regress, you can get fairly large size areas of ulceration and necrosis, which can have a tendency to release secondary bacterial infections into these areas. Seal pox. There are numerous seal poxes that are available or are present in our pinniped population. Seal pox is primarily seen around the head and face, mainly because of the animals, this is their major area of contact with one another. It does not seem to be a systemic disease as some of our pox viruses are. But as you can see, they're large, raised areas. This is a proliferative type lesion. It can look quite nasty, especially if it's around the face and lips on these animals. Histologically, as I stated, it's a proliferation. You see prominent proliferation of the epithelium with intercytoplasmic inclusions. Here's one right there. Several of them right here. These cells undergo ballooning degeneration, ultimately with pustule formation and necrosis of these areas. Commonly seen in young animals. Older animals, of course, are immune to it. We have one pox virus, which is seen in the South American sea lion, which is more of a inward growing pox with prominent red pegs down into the dermal connective tissue. But still, again, intercytoplasmic inclusions are seen with this disease. Here's just a closer photograph of the ballooning degeneration and intercytoplasmic inclusions that we see with seal pox. San Miguel sea lion virus. We heard about our vesicular diseases in swine today, and I heard that they said that if you feed San Miguel sea lions to pigs, then you get the disease. Well, we don't really know that. I like to think as a marine mammal pathologist, the pigs that gave it to them. However, probably was the other way around. This disease caused prominent vesicles in your sea lions. These will raise up and then ultimately ulcerate, causing slow healing ulcers over these areas of this animal. The interesting thing is where this occurs is primarily in areas where we have large populations of opali fish. The opali fish is able to have an active infection of this calicivirus. And of course, the opali fish is one of the mainstays of these animals here. So consequently, that's how the virus is disseminated in these animals. So it may not have necessarily been feeding a carcass of a San Miguel sea lion to a hog, but the ingestion of possibly opali fish or fish meal in the diet of these pigs that cause this disease to occur. The strains are very closely related to vesicular exanthema. There are several strains. There's some that cause vesicular lesions like this. Others cause abortion storms. Histologically, we see subcorneal pustules formation. These get large with prominent ballooning degeneration and necrosis down here in the stratum spinosum, ultimately leading to ulceration within these areas. Although this area appears to affect primarily non-haired regions, it also has been incriminated as causing oral lesions too. Looking at this photo, could you tell that from pox? If that was the only lesion we had, no. It's past this time. Similar lesions, vesicular lesions, have been seen in dolphins in which caliciviruses have been isolated occasionally. This is an interesting disease because it has been transmitted to man. So wear gloves when you're working with these animals. It gives them one extra layer to bite through anyway. So be careful when handling these animals because you may get a vesicular disease yourself. Feline hepatitis virus, this is an adenovirus. This is not a serious disease most of the time, and a large number of the sea lions have been exposed to the virus and have titers to it. However, occasionally an animal may come in that's quite debilitated, ill, and what we see is prominent necrosis of the liver with prominent intranuclear inclusion bodies present. These animals, this is a debilitating disease that is only really primarily, as I said, seen in younger animals, and most animals do survive this lesion. So I guess ICH of seals, if you want to call it something, it's not a real serious problem. Influenza virus. We talked about swine today getting influenza. There has been several influenza outbreaks over the years in seals, and they've caused serious high mortalities, which the animals have a severe bronchopneumonia present within these animals, with prominent hemorrhage, emphysema, mediastinal emphysema present. They're quite sick animals. Most of these animals usually have secondary bacterial infections by a mycoplasma associated with the influenza virus. What we see, of course, is if you take it as a bronchopneumonia with prominent infection of airway passages. This happens to be immunostain of, I believe it's influenza type A that was used on this seal here. The typical lesions that you expect to see with an influenza in swine. Probably a bronchopneumonia with prominent necrosis of lower bronchial airway epithelium, hemorrhage, depending on how serious of an infection it is, depending on how serious your lesions are going to be, and what kind of bacteria you have present within this animal. Morbilliviruses. Morbilliviruses over the past, what has been, about 8 years have come to be very prevalent in our marine mammal population and have been considered very serious. It first started out with outbreaks of a seal morbillivirus in the North Sea. These animals were seriously affected with large numbers of seals dying off. Most of these animals developed a prominent bronchopneumonia with abundant emphysema, mediastinal emphysema, which would go up into the subcuticular connective tissue and migrate down through the ventral abdominal cavity or ventral abdomen. These animals were quite ill, as one can expect. Look at them histologically. We'd see a bronchopneumonia with prominent, you can see here, intracytoplasmic inclusion bodies. Syncytial cells were occasionally seen within these animals. 2, typical morbilliviral infection. At the same time, several harbor porpoises were seen to have similar type infections too, which then caused, back in about 1990, a serious outbreak of dolphin morbillivirus was seen off the coast of Spain. And these animals, again, too, had severe bronchopneumonia associated with this disease. Histologically, what we would see in these animals, many times we would find large, very prominent intercytoplasmic inclusions present within these. And let me see, I can sort of the back side. Does anybody see intercytoplasmic inclusions there? They're there. I am at an angle where I think maybe right over here there's a couple. Intercytoplasmic inclusions, here's a couple right in here, would be seen within these animals. Associated with this outbreak, many of the dolphins that died had prominent erosions around the teeth. Now, whether this is a dolphin's version of Koplik spots, I don't know. But, and very little was done. No biopsies were taken of the epithelium in these areas. But one thing you may want to consider if an animal would come in and you do a biopsy or some evaluation, pathological evaluation, that you may find some epithelial necrosis, syncytial cells, intercytoplasmic or internuclear inclusions within these lesions in the oral cavity. CNS lesions were also seen in many animals with a prominent non-suppurative meningoencephalitis, a prominent perivascular cuffs, and intercytoplasmic and internuclear inclusion bodies seen, typical of what we expect to see in our morbilliviral infections. Herpes viruses have been seen in seals, beluga whales, and sea otters. Now, that doesn't necessarily mean that there aren't in the other marine mammals. They're there. It's just nobody hasn't found it. If you find an oral ulcer or something that looks suspicious, biopsy, I'll bet you find a herpes virus in one of these animals. Become famous. Seal herpes virus usually is a disease of young animals that are stressed. Most animals, what we see is oral ulceration in these animals, which then can lead to a disseminated disease in the immunocompromised animal. There's been several outbreaks in which we see prominent necrosis of parenchymal organs with internuclear inclusions. Oops. With internuclear inclusions that I believe right over here, several of them right through there, present. A good organ, of course, to find internuclear inclusions always is the adrenal gland, as in this case is right here. This is disseminated disease in these young animals and won't seem to cause problems. They have done some testing with this where they took a highly virulent strain of herpes, cultured it, attempted to give it to a group of orphan pups, and they came down with a little rhinitis. So depending on how immunocompromised this animal is, it will depend on how serious of an outbreak it will cause. Beluga whale herpes virus. This virus is a cutaneous lesion, a slow healing ulcerative lesion that come and go when the animal seems to be stressed. These little ulcerated areas on the animal, as I said, take a very prolonged time to heal. If biopsies are done, we see some ballooning degeneration of the epithelium with intranuclear inclusions present that are typical of a herpetic viral infection. Sea otter herpes is a herpes virus that was identified during the Exxon Valdez oil spill. This disease is characterized by various size oral ulcers in these animals. These animals that have prominent oral ulcers or plaque formation on the gingival surfaces, they seem to get along quite well. No serious problems are seen within these animals. However, again, debilitated animal, herpes virus, we all know what happens with herpes viruses, what they do. Notice, I think these are Keith Harris. All you know Keith Harris. I think these are Keith Harris's fingers. here. Notice he's not wearing gloves. Remind him that next time you see him. Herpes viruses, you know what happens when they get into aberrant host. Don't know what happened here. Bacterial diseases. Because these sea mammals are once terrestrial mammals, we got to remember the same organisms, bacterial organisms that affect a terrestrial mammal can affect the aquatic mammal. And so as you evaluate these diseases and look at these, don't be surprised if you would get a sick animal in and cultured and you got some pathogen that you'd expect to see in a pig or cow or some other animal and find it in that animal. They're out there. So remember also, many of these animals are in captivity. They're exposed to the same type of pathogens that we're exposed to. Culturing is really the only way you're going to always identify them. Erysipelathrix. This disease is not so much of a problem anymore because we do vaccinate our marine mammals against this. It's primarily a cetacean disease, and it's characterized by prominent infarction of the epidermis. There are two syndromes with this. There's an acute epithelial infection, getting dry. Erysipelas infection where the animal dies quite acutely with very few signs seen. If they do survive that infection, they may develop the skin lesion. And of course, look, diamond skin disease in a pig right here. However, most of the time, they may be single solitary infarctions in that animal. They don't have to be disseminated like that first photo. Some single solitary infarctions. Culture these areas, you may be able to get erysipelathrix from it. As I said, vaccination has essentially eliminated this disease from these animals. Again, epithelial erysipelathrix here. It can take on various, it doesn't always necessarily have to be a diamond skin type problem. Pseudomonas can cause serious problems in these animals. And again, this is a skin ulcer on these animals. Is it time?
We're on a big break now.
Okay. We'll start back here at Pseudomonas. Why don't we?
Take a 10-minute break. Don't forget before you leave.
And it can cause cutaneous ulceration in these animals, which can become quite debilitating and spread. Of course, Pseudomonas infections in people are quite dangerous. But these things can occasionally become systemic, causing severe bronchopneumonia in these animals at the same time. So Pseudomonas is quite a serious disease. Pseudomonas pseudomallii is seen primarily in Southeast Asia or in Australia region. This disease is a zoonotic potential and one of quite a bit concern to us that we need to be aware of and be aware of where these animals were captured. Consequently, we need to know a little bit of history about these animals so that we don't inadvertently expose ourselves to a serious disease, which can be quite debilitating. In these animals that are exposed to Pseudomonas pseudomallii, what we do get is prominent necrosis of parenchymal organs, which is, I believe this is liver here, with septicemic formation and potential bronchopneumonias in these animals, as we see here with necrosis of the lung tissue. Histologically, we see prominent numbers of bacteria present in these animals. Animals that so far, marine mammals that have been exposed to this, have not developed the chronic debilitating disease of bone lesions that we've seen yet. But remember this, if you're doing an animal that has been recently transported from, say, Southeast Asia or Australia, and it dies on you, think Pseudomonas, and be very careful so you don't expose yourself to something quite serious. Edwardsiella and Salmonella. These diseases probably are transmitted, well, at least Edwardsiella, through ingestion of fish. Salmonella, seems like all mammals carry Salmonella. These diseases affect both pinnipeds and cetaceans. What we see is a necrotizing enteritis and or septicemia in these animals. Of course, many times a bronchopneumonia is a common finding associated with the septicemia that's associated with these diseases. Not much you can do about it. Lepto. Lepto is a problem, and it's endemic in your California sea lion population. And then the California sea lions go through cycles of this, of abortion storms every few years. What we see is a near-term fetus, as we see here, will wash up on shore. Young animals will come up to shore, will beach themselves, be quite ill, tremendous high temperatures, a lot of back pain will be associated with this. They may recover, they may not. And the fetuses here, what we see on many of those is what they call red eye. We have some prominent hemorrhage in the anterior chamber in these animals. We also see prominent congestion and hemorrhage on serosal surfaces, congestion of lungs, and edema. If we look at the kidney, we usually see a tubulointerstitial nephritis, in which spirochetes are seen, just like any type of lepto case we could expect to see. But abortion storms in your area with young animals, usually young juveniles, washing ashore that are debilitated, intense pain and high temperature, think lepto on those animals. Very important not to bring them into your, if you work for a place, they won't bring those animals into their rehabilitation center. They'll keep them isolated for a while so that you're ensured that they aren't carrying something in that would just devastate the rest of the animal population. Dermatophilus. This has been occasionally seen in animals. You look at this lesion, you say, oh my gosh, that looks like seal pox. And it does have sort of a crusting, almost proliferative lesion. Many times it's, on this, it's around the head, but it can also be disseminated over the animal. If you take these off and look at them, you see prominent raised regions in here. But if you look real closely, you can see sort of a lamellar type arrangement there, suggesting epithelial necrosis growth, epithelial necrosis growth. Of course, histologically, this is what it would look like, and if we looked very closely at it, you'd see the typical stacked plate type characteristic organism that's characteristic of Dermatophilus infection. Very hard to clear up, as we always know in land mammals. It's just as hard to clear up in marine mammals. Mycobacterium. This can be a serious problem, and it's usually associated with a cutaneous outbreaks. These animals have slow, non-healing ulcers that, as you can see, become quite cavitary in these animals. It's a slow, progressive disease over a tremendous length of time. It takes these animals to get back up and go. Now, because although we saw this as cutaneous, don't forget it can become disseminated and form granulomas. This is a manatee lung. Look at the granulomas present within this manatee's lung, affecting numerous organs. Skeletal as well as parenchymal organs can be affected. Nocardia. Nocardia is seen primarily in your dolphins. Again, this disease is characterized by granulomatous formation. Here's a lung with this large mediastinal lymph node. I think I have, oh yes, here we go. Cut these open up in somewhat of a caseonecrotic center with abundant granulomatous formation within these areas. Occasionally you get septicemias with infarctions in brains and granulomatous inflammation in those areas. And mammary tissue, nocardia mastitis. Look at that necrotizing mastitis or necrohemorrhagic mastitis present within these tissues. Histologically, it's usually a granulomatous infection with potentially acid-fast positive organisms, filamentous organisms present within these areas of inflammation. Remember again, nocardia don't always necessarily have to be gram-positive, but they will have this filamentous type structure. Klebsiella. Klebsiella has been associated with fibrinous pneumonias in the California sea lion. I can't see why it would not be a problem in other animals too. Again, debilitating disease may be associated with viral disease too. But Klebsiella, fibrinous peritonitis, pleuritis, and pneumonia has been seen with these animals. Staphylococcus can cause pneumonia. It has been associated with pneumonias as well as cutaneous lesions in some animals. Again, think Staphylococcus, what it does on a terrestrial mammal, it can cause the same type of lesions in a marine mammal. Mycotic diseases. I'm going to talk on mycotic disease. I'm going to talk about the ones that are important. Again, there's been numerous cases of mycotic diseases in the literature caused by different normal mycotic infections. But I'm going to talk today about the primary mycotic diseases that you expect to see that cause serious debilitation in animals the most. Candidiasis is the most common one. This disease is associated with stress and antibiotic therapy on these animals. It can occur as a cutaneous lesion. As you can see here, almost sort of looks like thrush, doesn't it? Prominent hypertrophy of the epithelium with infiltration of it with hyphal structures. Or can occur on a mucosal surface as a severe ulcerative disease with necrosis and ulceration of epithelial surfaces. Histologically, the classic filamentous fungal hyphae here are seen. They usually are infiltrated through the epithelial surface. If they penetrate down deeper into the mucosal surface, then we get very much concerned. If they go disseminated, we can see multifocal lesions in numerous parenchymal organs. Kidney is commonly affected. Typical shape of these organisms. Loboi. This disease is a chronic granulomatous infection of pinnipeds, or not pinnipeds, cetaceans, I should say, mostly the Tursiops, in which there is a human counterpart. Now, the interesting thing is this is seen in marine or Atlantic bottlenose dolphins that live in the Caribbean, in the Gulf region. And in man, it's seen in a group of Indians that are several hundred miles inland that never see the ocean. Now, so both these animals, or man and this animal, are involved, and how they get exposed, no one really knows. But this is a slowly progressing disease. We see prominent discoloration of the surface with proliferation of the epithelial surface over it. Look how it's so rough. It can get to almost to the point of being a cobblestone pattern of this proliferation of the epidermis. When we look at it histologically, what we see in this is an intense inflammatory infiltrate in the superficial dermis. It's not deep, it's just superficial here. And it's intensely granulomatous. Very few other inflammatory cells present. Primarily macrophages and multinucleated giant cells, with numerous organisms observed. If we do a special stain on it, these organisms give the characteristic beaded appearance. I think they've described them as tinker toys. I call them beads. This beaded appearance here. Very characteristic for Loboa loboi. Fusarium species of bacteria or fungus have been observed in proliferative dermatitis in captive pinnipeds. It's believed to be due primarily to excessive chlorination and high water temperatures, leading to damage to the skin, causing lesions very similar to this proliferative ulcerative dermatitis, primarily seen on flippers of these animals. Histologically, what we see is epithelial erosion, ulceration, with numerous organisms present within these affected areas. Aspergillus is a serious problem. Probably next to Candida is probably one of the most serious fungal infections. Again, this is a disseminated disease leading to prominent infarctions, such as in this brain, hemorrhage and necrosis, and pneumonia in the lungs involved in these animals. This disease really cannot be tell much difference from zygomycosis unless you examine them histologically or through cultures. Again, more of these animals, we can see necrosis and ulceration of mucosal surfaces, as this trachea, infarction of kidneys. These things are seen with these infections. When you look at it, examine them histologically, of course you're going to have to identify, is it a zygomycetes or is it an aspergillus? And what we see is an intense inflammatory response, usually on a mucosal surface, with prominent downward proliferation of the hyphal elements. These, of course, disseminated to different organs, causing infarction and necrosis in those organs, leading to what we've seen in the other lesions. They're very spectacular lesions, very debilitating to this animal. These always don't necessarily have to go disseminated. There are many times that we'll find a healed granuloma with the fungal organisms present, and the animal died of some other lesion and had nothing to do with this. But usually they're observed with prolonged antibiotic therapy. Protozoal disease. Sarcocystis are very common in pinnipeds, occasionally seen in cetaceans. They're usually incidental findings. They have the typical Sarcocystis look to them that we see. There's recently been identified in the literature a Sarcocystis similar to Sarcocystis canis that has been associated with a disseminated Sarcocystis infection and death in a pinniped. Toxoplasmosis is seen in animals and has been associated with viral diseases. What you see in those animals is proliferation of tachyzoites in areas of necrosis, leading to disseminated disease and death in this animal. Typical of a typical of what we would expect to see in toxoplasmosis infection of a animal that would be a terrestrial animal. How they get it, we don't know. Pediculosis is very common in young animals. See numerous nits and eggs on the surface. These are all sucking lice. Don't be surprised, though, in a non-haired species, such as a pinniped, to find lice too. They're there. They're just buried down into the skin. Well, if you have an animal, look seriously over that epithelial surface. You may be surprised at what you'll find in that animal. Barnacles. Barnacles love to attach onto something and take a ride. There are two types, sessile and pedunculated ones. They really cause very minimal damage. The sessile ones can look very common like this. They're attached there. You see those on your baleen whales many times. They can also look like this, attached to the flute. You just catch it a ride, carry it along. Don't be surprised if you don't see them. Demodex. Demodex has been known to be associated with severe disease in California sea lions. We have seen Demodex also in sea otters, but not affected any. They were just an incidental finding. You find them in follicles in an animal with excellent pH. How these animals are affected, they usually see prominent hyperkeratosis and proliferation on the flippers in the axillary region.
Palms. Oh, just your mic.
Just dropped my back. Would I lose everything else?
Just having so much fun. You just
Yeah, you know
Didn't
me,
notice
I
it was
wander
gone.
away. Got me there? Got me
Yeah.
hooked up?
don't step on the wire.
All right. I'll try not to lose myself again this time. Whoops. Where was I? Oh, also down around the inguinal region, prominent hyperkeratosis, typical lesion that you expect to find in demodicosis in a canine. Skin scrapings, find this typical scar shape characteristics of a demodectic mite. Lung mites, they're common in seals and sea lions. Orthohyalurontia, the species. These little guys are very small, pinpoint, almost pinhead sized, white. Got to look for them. They really don't cause much of a problem. However, if you get an excessive number of them, they can cause some excessive mucus secretions. Have not been associated to be the cause of any bronchopneumonias in these animals. Paraphiloroides decorus, or lungworms of California sea lions. These can cause a severe bronchopneumonia in animals that are severely infected with these. These organisms, let's see, you can see one right here, one here, maybe over here. These organisms look histologically, we're all pathologists. We like to see what they look. They're typical metastrongyls. They live there in the airways. Most of the time they cause no problem. However, they can, if enough of them get there, can cause a secondary bronchopneumonia with bacterial problems. Otostrongylus is another lungworm. These cause large boli and dilated bronchioles. Worms you can see here can be quite large. Again, another metastrongyl infection. Contracecum and antisecans, these are stomach worms. When you eat that raw fish, that's what that guy's trying to do. Going to you, that's why you're at the hospital that night in intense pain. They're very common. Stomach worms are very seen. They rarely cause any trouble. Occasionally you may find a granuloma present in these fish or these animals. They're really not much of a problem other than sometimes they can be quite large numbers of these present within the stomach of seals. Here's a good spectacular view of a group of them sitting there in the stomach of this animal. Hookworms, Uncinera lacassi. This is the hookworm that has caused serious problem in the northern fur seal. This is your typical hookworm. what this hookworm does, it lives in the blubber, in the mammary tissue. When the female starts lactating, disseminates these to the pups. The pups get tremendous numbers of them, and they bleed out. If they happen to survive, they'll shed these at about 6 weeks of age. If they're infected again, the larvae go to the blubber or to the mammary tissue for them to wait till they get pregnant to pass it on to their offspring. It can be quite a serious, devastating problem in your rookeries off the Pribilof Islands. Zolophotrema hepaticum. This organism lives in the bile ducts. Doesn't really cause much of a serious problem in these animals. However, occasionally you'll see prominent fibrosis and of biliary ducts, dilation, possibly plugged with your typical fluke eggs. It's not really associated with any serious disease, but you'll see it. Orthosplanchus paterculus. This is a fluke found in the gallbladder sea otters. These little guys live here quite happily, don't really seem to cause much problem in these animals. However, they have been incriminated causing these little polyps within the mucosa of the gallbladder of a sea otter, and possibly some bile duct fibrosis. But they're an incidental finding most of the time. Acanthocephalids, very common in marine mammals. These parasites will live quite happily in the gut. It can become large numbers of them, with most animals not having any serious problem. However, in sea otters, occasionally these little guys have a nasty habit of migrating too far, causing intense peritonitis, rupture, and death in a sea otter. Large numbers of sea otters that do beach do have acanthocephalid infections, and it's usually due to a peritonitis in these animals. Heartworms. 2 species of heartworms. How am I doing on time? Okay. Heartworms. There are 2 species of heartworms that affect seals. These are Dipetylonema spirocauda and Diroflera immitis. Your wild animals, Dipetylonema spirocauda is the common one. Captive animals, Diroflera immitis is more common. What we see in those animals, this of course is a spectacular version, is typical heartworm disease that you'd expect to see in a canine. Heartworms seen in the right ventricle, pulmonary arteries. Occasionally you'll find them, if they're serious enough, up in the posterior vena cava. I've not known of this causing any problems like they have in the dog, but they're there. I can't see why they would not. The problem with identifying heartworm disease in your sea lion or seal population is this, that it's very easy to identify a Diroflera from a Dipetylonema. But the problem is this Dipetylonema and this Dipetylonema, which lives in the subcutaneous tissue, are very difficult to separate, and you're going to need a parasitologist to identify it. So if you're going to treat this animal with heartworm medicine, if you got Diroflera immitis, that's fine. You can treat it. But if you got Dipetylonema, wait a minute, send those microflaria to a parasitologist before you add heartworm medication to get rid of the problem in that animal. So you make sure he doesn't have Odentale, which is a non-pathogenic microflaria. Nasotrema mites, these are very common in the head sinuses of dolphins. They live up here in the head sinus quite happily. You'll see them all the time on a autopsy of a marine mammal, particularly dolphins. Nothing to worry about. However, when you have a beached animal and you're looking for it, you ought to look at that brain. They can migrate through these areas, causing intense damage if they happen to migrate through the sinuses into the brain. And this may be the reason for that animal beaching if it's by itself. Halocircus, these are lungworms of our dolphins. These are a little bit easier to see than Paraphiloroides. These live in the bronchioles, most of the time not causing any problem. However, large numbers of these get into these animals. And then, of course, you can have serious problems. The host for this is the opali fish. Here you can see the parasites here in a lung section. There's a little bronchopneumonia here present, bronchitis primarily here. I guess it's bronchopneumonia up here. Typical metastrongyl type parasite. Stenuris is another lungworm. These are very common in porpoises. They cause subpleural pulmonary nodules. Really, rarely a problem. However, and unfortunately, I do not have a photo of this. If you have migration to the tympanic bulla, these things do appear to maybe associate it with beaching of those animals. Here's a parasite I think everyone should know, and I always really feel that of any marine mammal, this is probably fair game for a day in September. These are these flask or urn-shaped flukes. They attach to the second chamber of the stomach. Really cause minimal damage, if any, to the animal other than being there. Histologically, what you can see, they sort of invaginate and pull up a piece of gastric mucosa around them. They live quite happily there without causing any problems. But this urn shape look to them is very classic and very easy to identify. Philetor gastrophilus. This is another nematode causing granulomas in the second chamber of the stomach of dolphins. These are prominent little nodules. As you're feeling the gastric mucosa, you'll come upon those, cut them out. You'll probably find this parasite present within those gastric nodules. If not, you may find an Anasaca type organism present in one of those. Cyclorchus. This fluke inhabits the bile duct and pancreatic ducts. It causes chronic fibrosis and hepatitis and pancreatitis. I'm sorry for the formalin-fixed tissue specimen, but you can see here there's prominent fibrosis of different ducts within this piece of liver, which is primarily what you see. It doesn't really cause too much of a serious problem in these animals, but for prolonged exposure to these animals, fibrosis is what you see. These animals have a very characteristic triangulated egg. Here's the organism living happily in the bile duct. I'd like to talk to you about a few neoplasms. Lymphosarcoma, well, since these are mammals, we should not be too concerned about finding a neoplasm in a marine mammal. As these animals get to live longer in captivity, we should expect to see neoplasm. Where it is real concern is where you find neoplasms in non-captive animals that are living out in some estuary that live there all the time. That may send up a red flag, and we'll discuss that here in a little bit. Lymphosarcoma has been seen several times in seals, proliferation, interstitial infiltrates within the kidneys, monotonous cell populations of neoplastic lymphocytes infiltrate. It could be a dog for that matter. Leiomyomas are seen. These animals are always quite fat, but if you look, these leiomyomas may show up. Look around, you'll see them. They're common. We find them in other species of animals. Why not here too? Esophageal duplication cyst. This has been seen in seals before. Within the thoracic cavity, you may see a large cyst like this here. When cut open, they have a brownish black material within inside of it. You look at it histologically, and what you have is a esophageal mucosa, a little smooth muscle there, epidermis here, some submucosa here present. You may also find some nerve endings, things like this present within that area. So don't be surprised if you find some sort of congenital anomaly in an animal that's doing quite well out there in the wild. Hodgkin's disease-like lymphoma in a killer whale. This is sort of an interesting one. This was seen in Japan. And they had a killer whale that began losing weight, died, had intense lymphadenopathy, hepato or splenomegaly present. Tissues were taken. Large, can we focus that a little bit? Large Reed-Sternberg-like cells present. Present throughout this organism. Now, you say, oh, okay, yeah, they look that way. If you do a LU-M1 on it, those large Reed-Sternberg cells were positive. So, called Hodgkin's disease. Why not? Tumors of beluga whales. This is a serious concern up in the St. Lawrence Seaway. And there's a population, a diminishing population of beluga whales found in the St. Lawrence Seaway. And large numbers of these whales have developed neoplasms over the past few years. One of the serious problems that they develop are mammary gland hyperplasia, which has been seen in these animals. Some of them lead on to adenomas and adenal CAs. Also, one of the other problems that they see with these animals, the prominent granulosa cell tumors in the ovaries. Of course, large numbers of these animals, this is disturbing, when you start seeing large numbers of tumors in a dwindling population of free-ranging mammals, sends up a red light. High incidence of cancer is seen of individuals in the same general vicinity. So it could act as a marker of degradation of our environmental quality of life in that area. Finally, we'll get to miscellaneous diseases, and we'll wrap it up here. Freshwater and cetaceans don't mix. You put this is not a real problem anymore because of regulations, everything. A cetacean can live in fresh water for a short time, but if you keep them in fresh water for too long, it'd be like you being in the bathtub too long. You start having ballooning degeneration of your epidermis and then ulceration. This can involve serious areas. If it gets a large enough area that's involved, of course, the animal can succumb to secondary bacterial infections. Putting back in the salt water, this will go away quite rapidly. Just a few other saltwater lesions from an animal being in salt water, or out of salt water too long. Pinniped hyponatremia. Your pinnipeds, we got to watch. Although it's seen primarily, seals can live in fresh water. Most of them do not. However, you got to watch these seals if they're placed in a freshwater environment. If they go down for any reason and you see a declining sodium level, you got to be very concerned that this is potentially the problem. Treatment is salt in the diet. It's been associated with vitamin E deficiencies too in these animals. So this is something that watch that. A normal is 150 to 160 milliequivalents per liter. You go down below that 150, you better give them salt in their diet. Vitamin deficiency. This is a problem that it's been affected both pinnipeds and cetaceans. The reason is due to ingestion of thiamase fish. Clinically, signs, they're nonspecific. The animal is anorexic, unresponsive, eat tremors, spasms. We really don't have a real good handle on this. Treatment has always been given B complex vitamins. They get better and they're feeling pretty well. However, what they've seen is sea lions that have died that they feel were thiamine deficient, or dilation of left ventricle, some myelin sheath degeneration. They've also seen some congestion and hemorrhage up here in the brain on these animals, maybe similar to what we see in other carnivores that are thiamine deficient. Vitamin E deficiencies can occur. Of course, we know why. Improperly stored fish. Seals is the most commonly affected animal. What we see is prominent massive necrosis. Muscles, myocardial and skeletal muscles are affected in these animals. Typical vitamin E selenium deficiency. Usually young animal that's evolved. So occasionally steatitis will also be associated with this disease. Capture myopathy. Most animals, marine mammals, are taught to be handled and everything else. However, if they're not, if they're during the capture process or they're struggling, the animals may be deficient in vitamin E, capture myopathy can occur. We all know what the histological lesions of that look like, typical contraction band development, things like this. It can be a serious problem in an animal that struggles. Just another photo of capture myopathy. Scromboid poisoning. Ingestion of mackerel or scromboid fish, same lesions that you'd see in you or I. If we ate some poorly preserved mackerel, you'd get irritable. My kids always sound that way. Inaptitude, debilitation, gastric ulcers, maybe pulmonary edema. These animals get off feed, take them off that, put a new feed into it. They have different stocks to go from. They're very cognizant of their animals. Suggest if they have an animal go off feed, put them on something else. See if the animal will take that. If it goes away, get rid of that fish. Here's one that's not a problem, but microophthalmia in the Ganges River dolphin. These little dolphins are blind. Of course, so if you lived at the Ganges River, it's always muddy, you probably wouldn't have to see anyway. But they're blind. They have a rudimentary eye here. Here's the eye histologically. But they get along fine without it. They live what few left. I shouldn't say get along fine. They're almost extinct. But that wasn't caused because they're blind. I think it's caused by other problems. Disaccharides intolerance in pinnipeds. There's always a good Samaritan that will capture a stranded pup, find an orphan pup, take him home, put him in the bathtub, get some baby formula or makes his own concoction of baby formula, a lot of milk. They'll keep him for a couple of days until disaccharide intolerance occurs. Then he's glad to get rid of him for you. These animals can get quite severe. Of course, they develop a projectile diarrhea, a lot of flatulence. They also can develop a dermatitis. Remember, seal milk is almost 100% fat. There's very little lactose present in seal milk. Gout. The Amazon River dolphin has a high serum uric acid levels. And if that goes off imbalance somehow, they can develop cutaneous granulomas or granulomatous dermatitis with urate crystals present. And as typical gout appearance, we'll see. Treatment, of course, is through allopurinol. Nephrolithiasis in your seals is very common. Typical stones present in the calyces of these raniculi are very, very common. Incidental finding. Heat prostration. Since these animals all have large amounts of fat on them, it's very easy for them to succumb to the heat. An animal that is beached, body temperature can rise quite rapidly. It's very important you keep them cool all times. If not, heat prostration will take effect. Typical signs, what we expect to see in heat prostration: tremendous pulmonary edema, maybe petechial and ecmotic hemorrhages over serosal surfaces, tremendous efflux of edema fluid in the lungs. But you got to keep those animals cool in order to preserve them. In the same vein, sunburn is a real problem in these pinnipeds, or cetaceans. These animals can develop, if they're in a shallow tank where they can't get too deep, they can, in the intensity as the sun goes, develop ballooning degeneration and signs is seen of a sunburn. The way they treat these animals is zinc oxide, just the way they treat your eye. It stays on in the water. Traumatic wounds. There's always somebody out there who wants to take a pot shot at them. Don't be surprised what you're going to find in the animal. You can find buckshot, as you see here, in this dolphin. Old wounds. It's amazing how tough these animals. This is a manatee with a harpoon lesion. There's always somebody who wants to get himself an animal like this. Don't be surprised what you'll find in these animals. These animals have the intense capacity to repair and compensate for damages due to them. But remember, each animal has a story to tell. And then also, when these animals get sick, shark bites. They're fair game out there in the ocean too. Remember, it's always eat or be eaten. So if you have these rake marks here across here with a big chunk taken out, he was trying to be